Afternoon, everyone. Michael, we'll start with our data slide. These are the key indicators today. And sadly, we have a shockingly high number of cases, 4,961. This is an all-time high. And to put this in perspective, about a month ago, about 4 weeks ago, that number was about 1,000. So now it is five-fold up and seemingly continues to go up all the time. So if you look at the deaths, sadly 33 deaths, that's a higher rate than we've seen. 2020 was the 21-day average. New hospitalizations, and we'll talk about this in a moment, 214, again higher than the 21-day average. And ICU admissions, 23, which is about what we have been averaging. Let's go to the slide in regard to cases. This is cases per 100,000 in the last 2 weeks. We've used this slide now for several months. And what has changed, we've seen the blue now creep across now into every county. So the CDC has high incidence, and what we are showing there is now that every county in the state of Ohio is a high incidence county. So it is everywhere. Can't hide from it. We can't run from it. We got to face it, and we have to deal with it. So no matter where you live in the state of Ohio, you now have high incidence. Sadly, you now have high incidence of COVID in your county. Michael, let's look at the next slide. This is the top 20 counties ranked by highest occurrence, the high incidence counties. If you are in one of these counties, your numbers are phenomenally high, very dangerous spread, certainly in these counties, starting with Putnam, Mercer, Auglaize, Holmes, Paulding, Noble, Defiance, and on down through those counties. Michael, let's go to the next slide. Let's talk for a moment about hospitals and what's happening, because we get questions about that. We continue to see increases in the number of COVID-19 patients hospitalized in the ICU unit and on the ventilators. Today we have a record number of patients hospitalized. 2,075 patients today is a 55% increase in hospitalized patients compared to 2 weeks ago. Again, 2,075 current patients today, and that is a 55% increase in hospitalized patients compared to 2 weeks ago. We have a record number in the ICU. That's 541. Our previous high was 533 in April. So you can see it from this chart. This chart goes back not too long ago, a few days ago, and you can see what it just continues, sadly, to go up. Let me now go to the daily new hospitalizations, the 7-day average. We'll look at this slide, and this gives it from a historical point of view. This goes back to March. So you'll see over here, when we started out with hospitalizations, you saw a very, very, very fast increase going up. You're seeing not quite as fast here, but it is going up at a very, very, very high rate. And this is much faster than we've seen it since the beginning. This is the incomplete data over here, and again, this is not filled in yet. But if it continues like it's been going here, it will fill in and continue at that high, unfortunately, at that high rate. Michael, let's go to the cases versus the testing. You know, one question we frequently get is, are cases increasing simply because we have increased our testing? And we have increased our testing. And it's true that we've been successful increasing our testing capacity during the past several months. Better testing helps us to detect and measure the spread of the virus in Ohio. Without testing, we would certainly be flying blind, and we have always wanted more testing, and so we've got it up significantly. However, cases have also increased significantly in the past several weeks. In fact, our case data has increased at a much higher rate than our testing has. So take a look at this chart. As you can see from this chart, since September 24th, total number of tests has increased about 44%. So this is the number, again, September 24th to the present, or actually till November 3rd. So total testing has increased 44%. We're happy with that. We want to continue to see that go up. But if you look at the increased percentage of cases during that same period of time, it's gone up 280%. So obviously, the increase in the cases is not caused just by the increase in testing. Let's go to our new data for the day. Our second part of the new data, the first is when we rank the counties 1 through 88. This is our map system, and this is the change that you're seeing here. And you can see, unfortunately, red is spreading throughout the state. The virus continues to spread throughout all regions of the state. Today we have 56 red counties, the highest number of counties that are red since we started the alert system. This is an increase of 13 from last week's 43. We have no counties that are purple, no counties that are on the watch list. In addition to our continued record-breaking case numbers, we are also seeing more visits than ever to doctors' offices. Those are early indicators, and emergency room visits, people going to the emergency rooms, resulting ultimately in COVID-19 cases. There are also a record number of Ohioans with COVID, as we said, in our hospitals and in ICU. The impact of COVID-19 is being felt by more and more families. We're seeing this in our weekly advisory system as well. Our 13 new red counties are Ashland County, Champaign, Clinton, Coshocton, Fairfield, Henry, Holmes, Jefferson, Medina, Morrow, Pickaway, Preble, and Sandusky. In each of these red counties, we are seeing high case numbers that are continuing to increase. Many of these new red counties are seeing sustained increases in visits to the doctor or emergency room for COVID. And some counties are seeing sustained increases in their residents being hospitalized for COVID. I want to take a moment to bring your attention to the 2 yellow counties in southeastern Ohio, which you'll see down here. And I was on a call this past week. We indicated that from one of the yellow counties that people thought that because the county was red, was yellow, that there was not a problem. It doesn't meet the indicators, but as I said, every county now in Ohio, even the 2 yellow counties, they are high incident level rating by the CDC. Last week, Noble and Monroe counties were yellow. This week, Monroe and Morgan are yellow. What we're seeing in these sparsely populated counties is an significant increase in cases, but because there are so few residents, the data that you would see reflected on our color map jumps around, and we don't see a continuous or sustained increase in cases, which is what's necessary for us to advance the county into the next level, the orange level. So the data jumps around. We don't see a continuous or sustained increase in cases or healthcare utilization in recent weeks that would flag the indicators in the health alert system. However, if you look at the past month or two, it's clear if you look at these counties that trends in these counties are similar, unfortunately, to the rest of the state. Situation is getting worse, and they cannot let their guard down. If you live in a yellow county, you can't let your guard down there either. A closer look at this week's map. The red counties have filled in much of northeast and southwestern Ohio and include urban counties, rural counties, and everything in between. Of the 13 new red counties today, 7 have never previously been red. Let me read what those are. These have not been red before. Champaign, Clinton, Coshocton, Holmes, Jefferson, Morrow, Sandusky. This high number of never before red counties is something that we've not seen since the early days of the advisory system. This is yet another sign that the disease is affecting ever more parts of the state of Ohio, parts of the state that previously had been relatively untouched by the virus. Let's look at the next slide, Michael. Here's a look at the percentage of Ohioans living in red counties. And you can see how this has changed over time. And you can see today is at, unfortunately, an all-time high. We're now at 86% of Ohioans, of our fellow citizens who are living in red counties. 80%. 6% of the population of the state is now living in a red county. 100% of the state's high incidence. That means that there are enough cases during the past 2 weeks to get the high incidence, that the risk of catching this virus in every county is very real and certainly is very concerning. As I mentioned before, our team talks to local health commissioners throughout the week. I talk to them at least once a week on Monday morning when we have all the health commissioners on a phone call. But they continue to share with us some of the stories, and we share them with you really just to kind of give you an indication of where we're seeing the spread. We're seeing significant community spread in every county. There's a lot of spread directly in households. So when one person gets the virus, so does the rest of the people who live in the home. Schools are continuing to do a great job. Social gatherings, including weddings and funerals and parties in people's homes, is really where we're seeing much of the spread. In some cases, the health departments have given us some stories, and let me just read a couple. A woman went to a wedding where she contracted COVID. She passed it on to her mother. Her mother is the caregiver for a couple in their 80s. Now the couple in their 80s have it. So you can just see it just passes from one person to another to another. Another example, a group of teachers had a Halloween party with their bubble of people that they usually spend time with. But there was another group of teachers at a party down the street. The group at the second party visited the people in the first party. As a result, there were COVID positive people in the second group, and now more than 10 teachers are sadly quarantined. Another story. College students hosted a house party that high schoolers attended on October 24th. About 80 people attended. There are now at least 5 positive cases associated with that party. Now I want to announce some key additions to our existing team that is fighting the coronavirus and additions to our administrative structure at the Ohio Department of Health. As you can see from the numbers, we are now at a critical juncture in our fight against the virus. Cases are spiking all across the state of Ohio. They are at an all-time high. At the same time, the good news is we're closer to getting a vaccine. As someone once said, it's always darkest before the dawn. But the light is coming. I'm confident of that, and so we need to be ready for that. Our game plan is straightforward and remains straightforward. The best way that we can defeat our common enemy is by doing three things. We must stick to the basics to not endanger ourselves, our families, nor others. That means back to the basics. Wearing masks, maintaining distance, not gathering in groups, especially inside. We almost continue to focus on protecting those that are most vulnerable of getting the virus. And we need to go on the offense with the pending arrival of the vaccine. Now, fighting a pandemic demands a multifaceted response, one that requires us to focus on our short-term needs, but also not lose sight of our long-term goals. And so it is very important that as we battle the virus, we continue to build out the Ohio Department of Health.